Hi, I'm Mary. I'm going to be your student nurse today. What's your name?
Emily,
And what's your date of birth?
22601.
And that makes you how many years old?
19.
And what do you do for an occupation?
I'm a student.
Where do you go to school?
Colby Sawyer,
And what's your major?
biology pre-med.
So I'm just going to ask if you have any pain today.
No, nothing.
Okay, so the patient states that she's not in any pain. She appears to be her stated age. She has good nutrition. She has good posture and positioning. Her skin appears to be pink, warm, and dry. It appears to not have any obvious lesions. She also has a good mental state. She is alert. Along with that, she is able to answer my questions at a normal response time and adequately. So next we're going to move on. She also has no obvious deformities. So today we're going to be doing a full head to toe assessment. So I'm going to start with your hands. So I'm going to be checking the skin here. They're pink, warm, dry. There's no obvious lumps, bumps, or bruises. Same on the other hand. I'm going to check for capillary refill. It's good. Now I'm going to check for skin turgor. The skin reacts fast, meaning she's not dehydrated. Next, I'm going to go to your arms. I'm going to check your arms for any obvious lumps, bumps, bruises, any skin lesions, any deformities. There's nothing obvious. The skin is pink, warm, and dry. So from here, we're going to do some range of motion. So I'm going to ask you to put your hands down and then flex them up. Elbows like this and up. And then out. And then I'm going to have you do your shoulders. So can I have you lift your arms like this and up behind your head, down, and then go backwards and like that. Awesome, thank you. So next we're going to work on your head and your face. So I'm going to feel around your hair, and I'm going to feel for anything that's deformed within the skull, if it's normal. I'm checking for hair texture and moisture as well. The hair has good moisture and there's no obvious signs of deformities with the head. Her hair is evenly distributed on her head, and the skin on the skull is pink, warm, and dry as well. So next we're going to look at your face. Can I ask you to take off your mask for me? So I'm going to feel the face for any obvious lumps, bumps, any bruises, any lesions. There's nothing that's obvious. The skin's pink, warm, and dry. So from here, we're going to do a few assessments of your cranial nerves. So the first thing I'm going to have you do is I'm going to have you smile for me, and then can you frown? And then can you show me your teeth? And then puff out your cheeks. Okay, so with this test, your cranial nerve 7 is intact. Next, I'm going to check for one part of the cranial nerve 5. So I'm going to have you clench your jaw for me, and then release, and then pretend as if you're chewing. Okay, so jaw is intact there and working properly. Therefore, that first part of the cranial nerve 5 is intact. Next, we're going to work on your eyes. So do you have any obvious or any known eye problems?
No.
Okay, so I'm going to put my hand behind your head, and then when you see it, I'm going to ask for you to say now.
Now. Now.
It's equal on both sides, therefore her cranial nerve 2 is intact. Next we're going to check for cranial nerve 4 and 5. So I'm going to ask you to follow my fingers with your eyes and not your head. Okay, so cranial nerve 4 and 6 are intact. Next, I'm going to check for your pupils. So I'm going to shine the light in your eye twice. I'm going to ask you to look over my opposite shoulder while I do. And now this one. So the pupils are equal, round, reactive, and they accommodate to light. Therefore, cranial nerve 3 is intact. Next, I'm going to look at your ears. So I'm going to feel for any obvious deformities. Do you have any pain when I do that?
No.
Awesome. So now we're gonna, do you have any problems with your hearing?
No.
No. Okay, so we're gonna check, I'm gonna do a nerve check of that. So when you hear my fingers rubbing together, say now.
Now. Now.
So it's equal on both sides, therefore cranial nerve 8 is also intact. The next thing I'm gonna do is we're gonna feel for your nose. So I'm gonna ask for you to tell me if you have any pain while I'm palpating. Was there any pain today?
No.
The skin on both her nose and her ears are pink, warm, and dry. Now we're gonna do a smell test. So I'm gonna ask you to close your eyes. I'm gonna bring an alcohol swab near your nose, and when you smell it, I'm gonna ask you to say now, but you're gonna block your opposite nostril.
Now.
Other side.
Now.
So both sides are equal and you're able to smell. So cranial nerve 1 is intact. Now we're gonna do a test of your mouth. The major thing I'm gonna have you do here is make sure your mouth is nice and wide open for me. So can you open for me? So when you take a look into her mouth, there's good buccal mucosa. Her teeth are well maintained, and her uvula is there. Can I have you say ah? When she says ah, it raises, and her uvula is midline. Can you look down for me? Her tonsils are there and not swollen, and the skin in her mouth is pink and not red or swollen. I'm gonna do one more mouth test. I'm gonna feel for your hard and soft palate. And there's no obvious deformity there, and they feel normal. She also has a gag reflex. Therefore, cranial nerve 9 and 10 are intact. Before you put on your mask, I'm gonna ask you to do one more test. So I'm gonna have you stick out your tongue for me. And can you say light, tight, dynamite?
Light, tight, dynamite.
Awesome. You can put your mask back on for me. With that test, we found out that cranial nerve 12 is intact. Next, we're going to move on to an assessment of your neck. So here, we're going to feel for anything that is abnormal or any lumps, bumps, bruises, that kind of thing. So now we're feeling for that. There's no obvious signs of lumps, bumps, or bruises. There's nothing that feels out of place. The trachea feels midline. I'm going to ask you to swallow. The trachea is midline even when swallowing. I'm going to check for your carotid pulse. Carotid pulse on the left side is strong and regular. And on the right side, it is also strong and regular, both at a 2+. So the next thing I'm going to do is I'm going to check for range of motion. So I'm going to ask you to shrug your shoulders and down, and then look towards my hand, and look towards my hand. Awesome. So the range of motion of your neck and your shoulders are intact, therefore your cranial nerve 11 is intact. So the next thing we're going to do is we're going to check for we're going to look at your chest and your lungs. So I'm going to ask for you to turn around for me. So first I'm going to look at the back. The skin is pink, warm, dry, and the curvature is not round, and she's not barrel chested. It's got a nice curve. So now I'm just going to feel for any deformities down along the back, along the spine. There's nothing that's obvious. So from here, we're going to go down to the 10th intercostal space, no, the 10th rib. I'm going to pinch in, and then I'm going to ask for you to take a deep breath and release. So the skin goes out evenly, therefore her lung capacity is even and she expels air evenly. From here, we're gonna do another test. So next time you feel, when you feel my hand on your palm, the palm of my hand on your back, I'm going to ask for you to say 99.
99. 99.
Wait, let's do that again.
99. 99. 99. 99. 99. 99. 99. 99. 99.
Good. So the next, the vibrations are regular, and there's no obvious signs of tactile fremitus. So next I'm going to percuss your lung fields. That test showed that your lung fields are predominantly resonant. Next, I'm going to listen to your lung sounds. I'm going to clean my stethoscope first. So every time you feel my stethoscope on your back, I'm going to ask for you to take a deep breath for me. Good. Now I'm going to ask for you to turn forward towards me. So now I'm going to listen to the lung sounds, to your airway sounds in your neck. So just breathe normal for me. Good, your airway sounds clear. I'm also now going to listen to the lung sounds in your chest. So every time you feel my stethoscope, I'm going to ask you to take a deep breath for me. Okay, so from here, I'm going to have you lay down, and we're going to do more tests of your chest. So the first thing I'm going to have you do is I'm going to have you look towards the left. I'm going to be checking for jugular vein distension here. There's no obvious signs of jugular vein distension on her right side, and look towards the right. On the left side, there's also no obvious signs of jugular distension. Her chest looks like it is, the skin color looks pink, it is warm, and it is dry. I'm going to look across her precordium for any obvious signs of lumps, bumps, deformities, any trills. Now I'm going to palpate and feel for anything. Again, no obvious signs of any trills. From here, I'm going to go to the mid-clavicular line at the 5th intercostal space. I'm going to feel for the apical pulse. Her apical pulse is strong and regular at a 2+. So now I'm going to listen to the heart sounds. So I'm going to be listening for her mitral valve. I'm going to be listening in the 5th intercostal space, in the 2nd intercostal space on the sternal border. Then I'm going to move along the 2nd intercostal space to the other side of the sternal border, where I'm going to listen to the pulmonic valve. From there, I'm going to listen to Erb's point. Then from there, I'm going to move down and listen to the tricuspid valve at the 5th intercostal space on the sternal border. Then I'm going to go along the 5th intercostal space to the midclavicular line, where I'm going to listen to the mitral valve. And from here, I'm going to listen to the apical pulse for 1 minute. So the patient's apical pulse was 56. From here, I'm going to re-listen over all the valves to hear if I hear any higher sounds, but I'm going to use the bell of my stethoscope this time. So at the 2nd intercostal space on the sternal border, I'm going to listen to the aortic valve. Then I'm going to move across the 2nd intercostal space to the other side of the sternal border and listen to the pulmonic valve. Again, I'm going to listen to Erb's point. Moving down into the tricuspid valve at the 5th intercostal space on the sternal border. Moving over to the mitral, which is at the apex of the heart, in the 5th intercostal space, midclavicular line. There are no signs of any higher sounds, and her heartbeat sounds regular. The next thing I'm going to ask you to do is we're going to do one more test for heart sounds. I'm going to ask you to turn to your left side. From here, we're going to listen for S3 and S4 sounds at the apical pulse. So there's no signs of S3 or S4 sounds. So from here, we're going to do a test of your abdomen. So first, I'm going to look across for any obvious signs of anything going wrong in your abdomen. I'm going to look for color. The umbilicus is midline. Skin is pink, warm, and dry. And there's no obvious signs of anything going on within the abdomen. Are you having any abdominal pain today?
No.
Okay, so the first thing I'm going to do is I'm going to listen to the bowel sounds. So I'm going to listen in each spot until I hear an active sign of a bowel. Starting in the right lower quadrant, moving to the right upper quadrant, over to the left upper quadrant, down to the left lower quadrant, so she shows normal signs of an active bowel. Next, I'm going to turn to the bell of my stethoscope and I'm going to listen in all 4 quadrants for vascular sounds now. I started in the right lower quadrant and moved to the right upper quadrant, over to the left upper quadrant, and down to the left lower quadrant. Okay. So there are no signs, signs or sounds for any thing wrong within the no vascular sounds. So the next thing I'm going to do is I'm going to percuss your stomach or your abdomen. I'm going to start in the right lower quadrant, up to the right upper quadrant, left upper quadrant, left lower quadrant. So the abdomen is predominantly resonant. From here I'm going to palpate. I'm going to start lightly. I'm going to ask if you have any pain to let me know. Is there any pain?
No.
How about up here?
No.
In here?
No.
How about down here?
No.
Okay. So now I'm going to palpate harder. Again, if you have any pain, let me know.
No. 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 No.
Okay, so there was no obvious signs of organ swelling. Therefore, we're going to move on to your lower extremity. So I'm going to start with your legs. So I'm going to feel your legs for any obvious deformities, any lumps, bumps, or bruises. There's no obvious signs of any of those. There's no lesions on the legs. Her legs are pink, they're warm, they are dry. I'm going to ask you to wiggle your toes for me. Okay, I'm going to first feel for the right posterior tibial pulse. It is strong, regular, at a 2+. From there, I'm gonna feel for the left posterior tibial pulse. That is also strong, regular, at a 2+. Next, I'm gonna feel for the dorsalis pediis pulse. That is strong and regular at a 2+. On the right side. On the left side, it is also strong and regular at a 2+. So the next thing I'm going to have you do is we're going to perform some range of motion. So I'm going to ask you to push down on my hands like you're driving a car and pull up on them. Awesome. Now I'm going to have you bend your knee for me. I'm going to have you rotate it out and back in and down. Same with the other leg. Awesome. So from here, I'm going to ask you to sit up for me. I'm now going to do a test for sensation. So I'm going to ask you to tell me when you feel the soft side of this Q-tip on your face.
Yep. 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 Yep.
So this check for that other half of cranial nerve 5, but I'm also going to check for peripheral sensation as well. So I'm going to ask that when you feel this soft side, you say soft, and this side as hard, okay? Close your eyes while you do this.
Soft, hard, soft, hard, soft, hard, soft, hard.
Okay, so your peripheral sensation is also good, therefore cranial nerve 5 is intact. Do you have any other questions actually we're going to do some balance and coordination. So I'm going to ask for you to stand up for me. What I'm going to have you do is I'm going to have you walk towards me, and then I'm going to have you turn around and walk back heel to toe. So there's no obvious signs of tics or tremors. Her gait is normal. So now we're going to do one more test, or a few more tests for coordination. I'm going to have you come stand over here. I'm going to have you stand with your feet together, hands down at your sides, and close your eyes. I'm going to watch for safety here just in case the patient falls. Just going to stand like this for 20 seconds. Patient's test comes back negative. She is good with coordination. So the next thing I'm gonna have you do is sit quickly up on the bed for me. So I'm gonna have you put your heel of one foot on the lower shin and raise it up to your knee, and the other side. Okay, one last test. I'm gonna have you look at me, and you're gonna follow, or you're gonna put your finger to my finger and then to your nose. Balance and coordination for the patient is intact. Do you have any other questions for me? Any concerns?
No.
Wonderful. I want to thank you for coming in today. And let me know if you have any questions or concerns moving forward.
Thank you.
Thank you. Do you think that was